though it is not Saturday, but we missed out on Saturday, so let us do it today. Uh, Before we start, let us have some few cases basically, which are very interesting, and I have cured this in about last 10 days. So when everybody joins in, we'll start it fast. I know that it's a very odd time. So it's a Wednesday, Thursday, and normally I take it on Wednesday, Saturday. So we'll take one more session on Saturday, but let us start today. So welcome Dr. Sayyed, Dr. Sikar, Dr. Tilwami, Dr. Bhavesh. There was an interesting case where the patient was suffering from toothache. A lot of toothache was there, and the doctor had diagnosed that because of toothache, there was a lot of pus in the gums and the teeth. Root canal had to be done. And the doctor had just cleaned the tooth and said that we'll take an X-ray. And on X-ray, good morning, Dr. Borkar. X-ray, there was a lot of pus, there was a lot of pain, there was a lot of swelling in the region of teeth. And the patient did not want to go for the operation, so she contacted us. What we had that case, the typical now normally when we have, because of an operation, because of the trauma, there was normally we think about arnica or staph aureus or ruta, whatever injury drugs is there. But in this case, surprisingly, when the patient told about symptoms that it feels as if the tooth has become hollow, the organ has become hollow, and on that symptom we prescribed a dose of Cocculus indicus 200 single dose. If you see in the repertory also, it is written that hollow sensation in the teeth, the remedies Cocculus indicus. Of course, we added few symptoms and we gave Cocculus indicus. Within 24 hours, the pus subsided, the swelling went, and it's been about 5 days now. The swelling has gone, the pus has totally dried up from the gums, and the patient is normal, so there's no need for surgery also, and there's no need for root canal treatment also. So the most important thing to learn in this case is, don't be very prejudiced on specifics. Sometimes it is so interesting that we say going for an operation, done an operation, give arnica or staph or calendula or ledampal, any other drug. But if there is a specific sensation, hollow sensation, तो patient हिंदी में बताया था कि वो पोक्कल हो गया, पोक्कल, and with that symptom Cocculus was given, and that cured the case completely in 7 days. So this is the power of homeopathy if your symptom similarity is very good. So if you don't have any questions, then we can always go to another case, and I'll just discuss that case. It was a very interesting case. Dr. Shavi, welcome. Nigam, welcome. So one more interest. Do we have some questions? We have some questions on, I think, Skype. That's why I'm looking at the Skype. No, so I'll answer that later. Dr. Ruhi, welcome. There was an interesting case, where the patient was suffering from a lot of mental problems, lot of sadness, lot of depression and all. There was a very interesting symptom that the patient told me, that in the case taking, that she basically does not want to explore her secrets, does not want to tell her the secrets, because she says that if I tell my secrets, I'll be like naked, मैं तो नंगी हो जाऊंगी, मेरे लाइफ में इतना ज़्यादा ये सब चीज़ें हो रहा है. So of course the whole case was taken, and there was a lot of there's a lot of depression and all. And how we prescribe, voice is disturbed, how we prescribe the medicine, that is very important. How we prescribe the medicine. She was suffering from depression, she had a divorce problem, she had sleeplessness problem, she had anxiety, she had a lot of other things, though she was already on homeopathy medicine, but there was no change. So this symptom, this was basically the crux of the case which I took. And we have a delusion that the patient feels as if she's naked. Now don't take a symptom of naked as if that she has to take off the clothes, and she wants to, in bipolar disorders or schizophrenia, she becomes nude in front of everybody. Don't take that symptom for prescription, because that is basically a common symptom. When the patient says that if I open up secret, if I tell everything, I'll be naked, मेरे पे कुछ बचेगा ही नहीं, मैं तो नंगी हो जाऊंगी, And with that symptom, we prescribed a dose of sulfur. If you see a symptom in sulfur, sulfur has a very interesting symptom: delusion, naked, he or she is. And that's how we entered the case. We added few symptoms with the patient had of sulfur, and we prescribed sulfur. 1 m single dose. In a month's time, she was about 50 to 60% better. The depression which she had for about 10 to 15 years, in 1 month she was much better. This is called this is called entering the core of the patient. Sorry for that. This is called entering the core of the patient, and that's why sulfur was given with very, very good results. So sometimes, it is very important to understand the crux of the case. Through mind also you can enter the case, and of course you get good results. So if you don't have any questions still, we could do we have any questions? I know it's basically nobody remembers that I take on Thursday, but just to compensate that Saturday YouTube live, I have taken it on Thursday. So a lot of people are not there who normally are on WhatsApp, and they have asked a lot of questions. So let us again go and see one more case. Now this was a case, this is I'm telling you a simple case where we prescribed only through the symptoms of physical symptoms. These days, we have cases, lot of cases where the patient is taking cold, whether the patient is eating cold food, cold drinks, and he gets coryza. And because of summer, the heat is so much, he's constantly basically drinking cold and all. And of course, our basic remedies, we have natamur, we have belladonna, glonine, arsenic, a lot of the remedies. But in this case, the most important symptom which we took for prescription is, in spite of so much coryza, like I have also, the patient basically had lot of, he used to always blow the nose and try to bring out the secretion from the nose. But he said that that does not ameliorate my cough. It keeps coming. And with this symptom, of course, we had prescribed the other remedies. With my assistant prescribed, there was no result. But then we prescribed a remedy where it is written that constant inclination to blow the nose, which does not ameliorate. See how you take the remedy for prescription. It does not ameliorate. It keeps coming in lumps, in mucus. It keeps coming. And which remedy we prescribed in that case? Anybody? With this symptom we took for prescription, that constant inclination to blow the nose, which does not ameliorate. Which remedy comes to your mind? There are 3-4 remedies which are very, very interesting. 2-3 remedies which I have used it lots in my practice with very good results. So can we have few remedies from doctors? Yeah? Anybody? Wants to blow the nose, blows the nose, discharge comes out, but the patient is not better. And he is so worried, and she's so irritable because of that. He feels, kitna andar jama hua hai, how much there is inside, I keep blowing, it does not get relief. What remedy comes to your mind? Anybody? Yes? We have new doctors online, so of course they can also tell some remedies. So 3-4 remedies that you should remember in your practice. First is Calibacrom, second is Sticta, and third is Teucrium marum verum. Of course, we prescribe the patient Calibacrom in that case. But how to differentiate Calibacrom or Teucrium or Sticta? A very, very interesting symptom of Teucrium, you should remember, that the patient has constant desire to blow the nose, and the discharge, and the discharge is very, very large. Yeah, good afternoon, Dr. Meera. The discharge is, yeah, Dr. Ru is right. Dr. Meera, I'll tell you the remedy of that case today only, the Alzheimer's case, I've just changed my mobile, so I could not see the case properly. So I'll tell you in the evening only. So Teucrium and Calibacrom is the right answer. In Teucrium, most important symptom is the mass. The discharge is very large. This is very important, Teucrium verum. While is in Calibacrom, as you all know, it is stringy, it sticks in like ropes, and that's why this is the differentiation of Teucrium marum verum and Calibacrom. One more symptoms, it is basically written in Teucrium nose that the breath is foul. There is a lot of foul breath in Teucrium marum verum, and there is crawling in the nostrils with lacrimation and sneezing. With lacrimation and sneezing, don't always think about euphrasia or allium cepa. Thucrium, crawling in the nose with lacrimation and sneezing. One of the very important symptom of Thucrium is one more symptom is that coryza with stoppage of nostrils. Coryza with stoppage of nostrils means he has coryza and the nose becomes stopped. The nose stops up. This is again a very interesting and a very important symptom of Thucrium varanvaram. I am not going to tell you about Kali Bacrom, but because I feel that Kali Bacrom, everybody knows the stentage discharge, everybody knows. One important remedy, that is Sticta pulmonale, which I must have taken I think in before my YouTube, but just to differentiate Sticta. In Sticta, in Sticta, like Nakswamika, there is feeling of fullness at the root of the nose. There is feeling of fullness at the root of the nose, and again constant need to blow the nose but no discharge. This is a very important symptom of Sticta pulmonale. Coryza, remember, constant need to blow the nose but there is no discharge. This is how you have to differentiate each remedy, so that when the case is come in front of you, you are able to differentiate and prescribe the remedy. Of course, there are cases where the patient has constant desire to blow the nose with hoarseness. When there is hoarseness and constant desire to blow the nose, you must think about the remedy golden seal. Normally I prescribe golden seal 30 and that gives me good results. Sometimes I repeat 2 times a day for 3 days. Remember golden seal. So this is in relation to acute cases of coryza that normally will come to you in this type of weather, because patient is taking a lot of cold. Of course, lot of cold, you can think about arsenic, you can think about pulsatilla, you can think about aconite, but if the symptoms are very peculiar to that particular case, like I said, you inclination to blow the nose, then you must think of these type of remedies. There was a case, of course, there's no question asked today. There was no questions. There are a lot of new doctors on Instagram and YouTube. You may ask questions, I'll start telling cases. There was an interesting case of Kathar, and the most important, I'll not read the whole case because we don't have so much time. There was lot of Kathar with lot of patient बोलता ना कि मेरे को बहुत सर्दी और यहाँ बहुत दुख रहा है. सिंपल सिम्टम, मतलब सिंपल लैंग्वेज में पेशेंट ऐसा बोलता है कि मेरे को इतनी सर्दी है डॉक्टर, इतनी सर्दी है और पूरा सामने का सर दुख रहा है. Whenever you get this symptom like Kathar with frontal headache, Kathar with frontal headache, anybody can give me the answer? A very important and a very infrequently used remedy you must remember is Asclepias tuberosa. Asclepias tuberosa. Asclepias tuberosa is a very good remedy when the Kathar, आपको पेशेंट आके बोलता है ना डॉक्टर मेरे को बहुत सर्दी हो रही है और बहुत सर दर्द हो रहा है, then you must think about this remedy. Welcome Vishal, welcome Sparkling Samir. Sorry for the disturbance. I have a lot of coryza. Now, whenever you get Kathar, especially in old people, okay, or whenever you get Kathar in cold weather, do think about arsenic, do think about carcinogen. Both the remedies you know very well. But lately, I have been getting cases of old people. They have a lot of Kathar problem, especially old people. I've seen after 70, 75, there's a lot of problem. They drink and they get a lot of Kathar symptoms. Normal remedy does not work. You must think about creosote, you must think about alumina. These are very important remedies where you must think about these remedies, creosote and alumina. So still we have no questions from Instant YouTube Live. All doctors today are I think new. Good afternoon मिश्रा जी. मैं वही देख रहा था कि पुराने डॉक्टर्स आज और टाइम पे मेरे YouTube लाइव में नहीं दिख रहे, नए डॉक्टर्स दिख रहे हैं. बहुत बार आपको केस मिलेगा कि पेशेंट को बहुत सर्दी हो रही है, पेशेंट को बहुत सर्दी है और पेशेंट बोलता है मेरा नाक पूरा ठंडा हो जाता है, मेरा नाक पूरा ठंडा हो जाता है. मीन्स देयर इज कोल्डनेस एट द टिप ऑफ द नोज बिकॉज ऑफ कठार प्रॉब्लम. कभी आया प्रॉब्लम ऐसा आपको? नोज पूरा ठंडा हो जाता बिकॉज ऑफ कठार प्रॉब्लम. और कौन सी रेमेडी हमारे दिमाग में आती है? एनीबडी? The tip of the nose becomes very cold because of coryza. Which remedy comes to your mind? Anybody? There are few remedies which are very, very important that you must think about. Sheetal Patil, welcome. First, of course, in mathematical remedy, there might be some different remedies also. But I have got good results with Veratrum alb. First, second, arsenic album. Third is calcarea phos. And the fourth, surprising, is camphora. In books, there are a lot of other remedies also, but these four remedies are very, very important in these type of complaints. आपको मिलेंगे. The patient says the tip of the nose becomes very much cold. Dr. Fatima, yeah, welcome. In this way, we are just discussing coryza, Dr. Fatima. And now, if you have coryza, कभी कभी अभी क्या होता है कि in this summer, what happening? There is a lot of rains also in between, and sometimes the air becomes very cold. So whenever there is coryza and because of cold air, the complaint aggravates. Because of cold air, the complaint aggravates. Most of the time, these are three remedies which I have used in my practice and got good results. The first is Dalkamara, the second is Calcarea phos, and the third is phosphoric acid. And you'll be surprised, change of weather also is Dalkamara. In fact, when there is coryza from draft of air. What do you mean by draft of air? कि हम we are going in a bus, we are going in a train, and वो जो खिड़की रहती है ना पूरी बंद नहीं होती, वहां से बहुत हवा की ऐसी झोंके आते रहते हैं, ड्राफ्ट आते रहता है, और पेशेंट नेक्स्ट डे मॉर्निंग बोलता मैं कल ट्रेन में से आया, मुझे बहुत सर्दी होगी. I have come from the train and I've got coryza. So whenever you have coryza because of draft of air, you must think about remedies like draft of air. Again, Dalkamara, Natrum Carb, Elapse, and Moxol. Okay. I saw many doctors took many medicines, but most of medicine besides doctors gave me any relief. Rather, some of them increased suffering. Oh. Okay. Lump in mastoid region, round in shape, movable, pain, inflammation, redness to what to give. Whenever you have pain in the mastoid region, mastoid region basically, you must think about, whenever there's pain, there's inflammation in the mastoid region, two or three things are very, very important. And one thing you must remember in that case is that whenever there's pain in mastoid bones, make sure that patient is, I've seen a lot of cases where the patient suffers from infection in the teeth, and that radiates to that process. Mastoid process. So make sure that you are basically taking a disease process also. So whenever this pain in the mastoid process is, now I'll tell you generally first and then tell you the sides. That is, you must think about few remedies that which I use is, first is lithium carb, diascoria, capsicum, and fluoric acid. Especially when there is pain in the right side, diascoria is a very, very important remedy, because in diascoria, if you see, there are a lot of symptoms related to mastoid process with capsicum. Now, capsicum again is a very, very interesting remedy for mastoid process, but that deglutition, aggravation, and bad foul smell is also very important in capsicum to remember. Sometimes, there is swelling in the mastoid bone, then you must think about capsicum. When there is in fact only pain, then you can think about these three remedies which I have told you in my practice. Remedy for tiny acne on forehead. Whenever there is acne on the forehead, first of all, make sure that normally it is psoric. If it is psoric, then there is no need for giving medicine, which I always tell you. But if there are acne on forehead, especially during menses or without that also, I'll tell you both of them. You must think about causticum, you can think of sulfur, hipasa, silicea, and carbovage. These are the remedies you should think about. Sir, a few months back, I took one dose of concentrated remedy, Bravanial 6C. After taking medicine, miracle happened and recovery process started. After taking medicine, toxins started releasing. Very good, Dr. Nilesh, and I'm very happy that you got relief with that medicine. So I hope, Dr. Fatima, tiny nose. So it is differentiate basically, yeah. Sir, had 82 years old lady, talk relevant, hot, moderate thirst, Alzheimer's, schizophrenia. What should I give? Please I give agaricus, but no change. Yeah, I think you have sent me the case on WhatsApp. Also, I'll read the case fully because it's very important to see the whole case. I'll tell you the remedy on WhatsApp, okay? And we'll share the case next time on the YouTube on Saturday. What we give. So you got the remedies on the forehead, Dr. Fatima. Of course. Then sorry for this. Uh, One more thing which we basically have to remember in such type of cases in forehead, sorinum, arsenic and sepia also works very well. Of course, the symptom similarity also has to be there. Yeah, Riaz Menin, welcome. So agaricus you have given 82 years old case, talks irrelevant. You must think, you just write down, tell me the process of life. What trauma, what element from cares, worry, trauma she has suffered from that has taken toll of her mind, and the mind has been so what you call traumatized because of that cares and worries and trauma and emotional thing. Because of that, she has lost this memory. The mind is basically switched off. So if you could add some symptoms of a lifespan, then we'll be able to prescribe the medicines very nicely. Yeah. So next question, or if you don't have any questions, we'll again go, and I'll just differentiate some of the remedies, in basically getting forehead. Now I had interesting cases, and the interesting remedy also, Dr. Fatima. Dr. Sheetal, patient came with different complaints of menses alternating with eruption, searching for the rubric. See, whenever the menses is alternating with eruptions, now if you go to a mater medica, if you go to a mater medica, there are a lot of remedies, and the first remedy you should think about sulfur and pulsatilla and viburnum and gossypium. But whenever I have seen in these type of cases alternating symptom, it is there is a basic pathology inside, a mental pathology inside, which the body is not able to take care of, and the body is always trying to come out in some alternating manner. In this case, you must get the mind symptoms, why the body is behaving in such a way, and then go into that. Otherwise, alternating rubrics we have, but I have not seen classical results with these type of complaints. I have seen more results where I have basically seen that mental element. There is a basic mental element behind that, which is the body is behaving such a way. For example, if you say menses alternating with discharges, menses alternating with bronchial troubles, menses alternating with skin trouble. So we have phosphorus, we have tarantula, we have epismel, we have sabina, we have sulfur, we have pulsatilla, a lot of remedies. You give it, improves again back to square one. The underlying mental pathology is very important to prescribe in these cases. Just a minute, Dr. Nilesh. Dose of 3x potency, but also didn't work. And some days later, I took one dose of 3x potency, but the medicine didn't work. See, normally in case of corazon, if you feel that the remedy is right, normally if you ask me, Dr. Nilesh, I give normally 200 potency. But if you want to repeat, then the LM potency is much better. Sir, for new doctors, can you please share some app for case taking? No. See, we have learned case taking, we have learned from good stalwarts and all, but case taking for me is very individualistic. There is no protocol. Ask this, ask this, ask this. Basically, case taking depends on how the patient is come to you, how the patient is answering the questions, when to ask what questions, when to stop the patient to answer questions. It is basically individualistic. Of course, you must read the protocols of case taking from Kent or Hahnemann, but when the patient is in front of you, it depends upon your skill, your art, how you ask the question and take out the symptoms from the patient's personality. Just a minute, few questions have scrolled. Early widow, also taking widow, 3 daughters, complaint started after a fall, fracture and death of close relative. In front of she was attached. Yeah. So just let me repetize this case and get back to you. Dr. Sheetal, thank you. Dr. Rujul Manshud, Dr. Yeah. Sir, new doctors. I hope you understood, Dr. Nils. I hope I am able to pronounce your question properly. So if we have a case where there is a lot of trauma, Dr. Mira's case, there is a lot of trauma, she's a widow, She has passed through a lot of trauma, and now, as you say, that she has lost her husband early, three daughters. So in this case, what you have to see, the group of remedy that comes to my mind, if I tell you, thermal status. See, again, I'll tell you, there are some cases, there are some patients who are not able to describe their thermal status properly. They say, okay, this is okay, this is okay. When the thermal status is absolutely very important. For example, I had a case where normally in Nagpur the temperature is 44, 45 degrees Celsius, and the patient says, no, in this weather also I require hot water to have a bath. I still take covering. Then the patient is out and out chilly. Or if the patient says that even in the winter season the temperature is 1 degree, I basically require cold water or slight warm water, then the patient is hot. So if it is a defining symptom, and if you can classically get the symptoms thermals, you must take for prescription, because that is the constitution of the patient. That is also important. Okay. As we go further, what was I'm telling? Yeah. So Dr. Meera's case, there is a lot of mental suppression, mental emotions in this case. You may think about some common remedies. Valeriana is natramur is there, phosphoric acid is there, Nux moscata is there, ignitia is there, or metallicum is there. But still, this case would require some more symptom, which you can send me on WhatsApp, and I'll definitely tell you the answer. Yeah, Dr. Rizwan Manan, thank you. See, there is no fixed thing that I'll go enter the case through this angle, through that angle. Fine, you may enter the case through. But what is the symptom that defines the patient constitution? What is that symptom that is present in the patient from SORA to psychotic to syphilitic, gradually increasing in intensity from SORA to syphilis? What symptom basically the patient is carrying in spite of all treatment he is not cured of? That is more important to us. So in case taking, that is very important. Patient is hot. Okay, Dr. Fatima. In case of Alzheimer's disease, okay, we'll discuss that later. Few questions on YouTube has scrolled up. Dr. Nilesh, you had written a lot of things, but it has scrolled up. Yeah. So potency wise, I always tell you, Hahnemann's 6th edition of Organ of Medicine. If you have LM potency, then you can definitely use LM potency, because aggravation is minimized and repetition is okay, and you can repeat every 10 minutes, 15 minutes in acute cases also. So, and every time you give 10 strokes, so the vital force is affected with a higher potency than normal. In C potency, you repeat the same potency and the vital force may get acclimatized with that and will not give show results. So LM potency is much better. In this case, if you have LM potency, then you must think about LM potencies. Sorry. So I hope case taking is basically a very, very interesting topic. Whenever I take classes and I take seminars, all students basically ask me case taking, sir, how do you enter the case? How did the patient tell you that symptom? Now I don't have an answer for this, because it's an art. You develop that art gradually in your practice. Sometimes you follow the protocol and ask direct questions, but as you mature in your practice, automatically your miasm also changes in case taking, and automatically what happens? You develop that eye, what to ask and when to ask that patient. So it's a very interesting topic. It may require a lot of time, but keep on asking the patient, and keep on exploring the patient's mental condition or physical condition, whatever is a defining feature of that patient's personality. So I think that was a nice interaction with some new doctors. They were all new doctors, because old doctors will always be thinking that I'll take YouTube on Saturdays. Though I'll take on Saturdays, but today was a surprise YouTube, because I missed that on Saturday. I was for some personal reasons. So now one of the very interesting questions that was asked me on my WhatsApp group, that elements from cares and worries, or elements from grief. Cares and worries, there are a lot of other elements. So elements from grief, and the patient is not able to cry. एक सिम्टम बहुत ही अच्छा एक पूछा था कि patient has lot of grief, patient has lot of sorrow, but the patient cannot cry. Very, very interesting thing. Of course, natramur is a remedy where the patient cannot cry. But in that case, I prescribe the patient, we take the whole case and prescribe the patient pulsatilla. And immediately the doctor asked me, sir, we have told pulsatilla cries so much, and you have given pulsatilla. So that's why I always tell you, don't be so fixed in your practice. Pulsatilla also have grief and sorrow, and sometimes care. He cannot cry. Pulsatilla is there, natramur is there, gelsemium is there, carcinosin is there, opium is there, of course, Naxomica is there. Cannot cry also. So that was a fantastic case where we have to explore our vision of mathematics also, and that's why go with the flow. What the patient is telling you, repetize that. Don't have periodize, guy. If the patient is crying, I'll give pulsatile. If the patient is very hook, patient is very adamant and businessman, he wants everything according to him. Naxomica, very angry, so anacardia, Merksol. Don't be that. Take the case, calm your mind, see the disease and see the miasm, and then if you basically repetize the case, you'll be able to hit the simulum every time. So I hope you enjoyed this today's session. I hope you enjoyed it, because new doctors, thank you for joining me, and I hope you enjoyed as much as I enjoyed sharing my thoughts with you. So thank you very much. Meet you again after 2 days on Saturday for a next YouTube live at 3 p.m. Thank you very much. Palak, you joined late. Next on Saturday we meet again. Thank you so much.